Have you ever wondered if a single touch could completely change the way your partner feels about intimacy? After 60. Many men believe that once the years pass, passion naturally fades and there is little left to do beyond routine affection. But the truth is different. What I have seen over and over in my practice is that a simple massage technique can awaken a level of pleasure and connection that couples thought was long gone. Imagine the surprise on her face when a touch that feels ordinary to you suddenly makes her breathe deeper, relax more fully, and respond with a spark you have not seen in years. This is not about complicated tricks, expensive treatments, or trying to act young again. It is about knowing how to use your hands with patience and purpose. Do you believe one touch could change everything? Comment number 1 if you agree, or hit like if you are still not convinced. I am Dr. Laura Bennett, a urologist who has spent more than 2 decades working with men and women in their 60s, 70s, and beyond. During these years, I have listened to countless couples share their frustrations about intimacy. The husbands often say to me, "Doctor, I just don't know what else to do. I try to be affectionate, but my wife seems distant. And when we do come together, it feels rushed, almost like an obligation." The wives quietly admit, "I miss feeling desired. I miss being touched in a way that makes me feel alive." These are not rare stories. They are the quiet reality for many couples who still love each other deeply, but feel that passion has slipped through their fingers. The problem is not that desire has disappeared. It is that the body changes with age, and what used to work no longer has the same effect. Circulation slows, hormones shift, and muscles lose some of their natural tone. Because of this, women after 60 often need a different kind of stimulation, one that is more gentle, intentional, and consistent. The men, on the other hand, were never taught how to adapt. They keep trying the same hurried touches, or ignore the importance of touch altogether. As a result, both partners feel disconnected. But here is the good news. The solution does not require medications, expensive devices, or complicated routines. It requires knowledge and a willingness to approach intimacy differently. Massage, when done correctly, is one of the simplest yet most powerful tools you can use. Before I explain exactly how it works, I want to hear from you. Have you ever felt like intimacy has become more mechanical than meaningful? Comment number 2. If this sounds familiar, or hit like if you believe you are still doing fine. One of the most common mistakes I see among men after 60 is assuming that intimacy should look exactly the same as it did decades ago. They think the only important part is penetration, or they believe a quick kiss and a few rushed strokes are enough to satisfy their partner. This assumption is not only wrong, it is damaging. When a woman feels that her needs are being overlooked, she begins to associate intimacy with disappointment rather than joy. Over time, she may avoid physical closeness altogether. I once treated a patient named John, a retired engineer, who came to me at 65. He told me, "Doctor, my wife doesn't want to be intimate anymore. She says she feels nothing." At first, he thought it was her hormones, maybe even early signs of illness. But as I asked more questions, it became clear that John had never truly paid attention to the way he touched his wife. For years, his routine was the same: a short hug, a quick attempt at intercourse, and frustration when she turned away. He admitted he never considered that his wife might need a longer build-up, a gentler kind of stimulation, or that something as simple as massage could transform the experience. This is the silent pain many couples share. The husband feels rejected and begins to doubt his masculinity. The wife feels unseen and emotionally neglected. Both partners love each other, yet neither knows how to bridge the gap. By ignoring the power of touch, especially massage, they unintentionally build a wall between them. And that wall grows thicker with every failed attempt. Here is where I want you to reflect. Have you ever sensed that your partner was not fully present, or that she accepted your touch more out of duty than desire. Comment number 3, if that sounds familiar. Or press like if you believe this has never been a problem in your relationship. Remember, honesty is the first step toward change, and you may be surprised how many men share your exact struggle. To understand why massage can be so powerful after 60, let us take a simple image. Imagine the body as a garden. When we are young, the soil is rich, the water flows easily, and flowers bloom with little effort. As we age, the soil becomes drier, and the streams that once nourished it begin to slow. But with the right care, with attention, and steady watering, the garden can still flourish. Massage is like watering that forgotten soil. It awakens circulation, brings warmth to cold areas, and restores vitality that many couples assume is gone forever. From a medical perspective, here is what happens. When you gently massage your partner, especially in areas like the hips, thighs, and lower abdomen, you stimulate nerve endings that send signals to the brain. These signals tell the body to release chemicals, such as oxytocin, sometimes called the bonding hormone, and dopamine, which is linked to pleasure and motivation. At the same time, massage increases blood flow. Better circulation means more oxygen and nutrients reach the tissues, which in turn heightens sensitivity and arousal. Think of it this way. When you rub your own hands on a cold day, they slowly become warm and tingly. That warmth is blood rushing in response to touch. The same process happens in more intimate areas of the body. For women, this increased circulation helps with lubrication, reduces discomfort, and sets the stage for stronger responses to further stimulation. For men, it eases performance anxiety and creates a sense of confidence that is not forced, but natural. Scientific studies back this up. The American Journal of Sexual Medicine reported that couples who practiced structured massage for just 10 minutes 3 times a week saw significant improvements in both physical satisfaction and emotional closeness. These results were more consistent than those achieved with medications alone. This proves what many of us already sense deep down. Real intimacy does not start with performance, it starts with connection. Now I want to hear from you. Have you ever experienced a simple touch that sent a wave of relaxation through your whole body? Comment number 4 if you know exactly what I mean. Or press like if you are still skeptical and want to see more evidence. So what can you do tonight without waiting months or buying anything expensive? The answer is to start with a short massage routine that focuses on comfort, relaxation, and gentle build-up. Let me guide you step by step. First, create the right setting. Dim the lights, ask your partner to lie down, and place a soft pillow beneath her hips to allow her body to rest naturally. Begin at her shoulders, using slow circular motions with your palms. This helps release tension and tells her body that she is safe. Then move gradually down her arms to her hands, paying attention to each finger. The goal is not speed, but presence, showing that every inch of her body matters to you. Next, place your hands on her hips and gently trace circles as if you were drawing patterns on warm sand. Spend several minutes here, then shift toward her thighs. Use the flat of your hand on the outer thighs, then gradually transition to the inner thighs, moving slowly so her body has time to respond. Do not rush toward intimacy. Let her anticipation grow with every careful touch. Even 5 or 10 minutes of this steady rhythm can begin to awaken areas that have been dormant. I remember one patient, Mary, who was 62. She told me, "Doctor, I thought my days of feeling excited were over." But after her husband learned this simple routine, she said it was like discovering a switch she did not know she still had. Their intimacy transformed, not because he became a new man, but because he learned to slow down and give his touch meaning. This is something you can try right away. Tonight, set aside 10 minutes and follow these steps. Focus on her comfort, listen to her breathing, and notice how her body reacts. You may be surprised by how quickly a sense of closeness returns. And I want to challenge you, are you willing to give just 10 minutes tonight to see if this works for you? Comment number 5. If you are ready to try or hit, like if you think you will need more time before you commit. Short-term actions can spark immediate change, but lasting transformation requires a system. When couples want intimacy to flourish after 60, they need more than one evening of massage. They need consistent habits that touch every area of life: physical health, emotional connection, communication, and environment. Let me walk you through the pillars I teach my patients. The first pillar is physical care. The body at 60 is not the body at 30, but it is still capable of wonderful responses. Gentle daily movement, such as walking or yoga, improves circulation and flexibility. Men who maintain even light exercise have more stamina during intimacy. Women who stretch and move regularly report fewer aches and greater comfort when touched. Think of your body as an instrument. If you tune it a little each day, it produces music much more easily. The second pillar is habitual touch. Too many couples wait for special occasions to be affectionate. Instead, I encourage what I call the 15-minute ritual. Each night before sleep, spend at least 15 minutes on non-sexual massage. Shoulders, arms, back, or feet, choose whatever helps your partner relax. Over time, this creates trust. Your partner's body learns that your touch means safety and warmth, not pressure. And when intimacy does progress further, the response is much stronger. The third pillar is emotional conversation. Many men struggle here. They assume silence is safer, or they fear sounding weak if they ask, "What makes you feel good?" Yet research shows that couples who talk openly about desires experience up to 70% higher satisfaction. I remember counseling Robert and Linda, married 40 years. Robert confessed he had never asked Linda directly what kind of touch she liked. When he finally did, she cried not because she was unhappy, but because she had waited decades for that simple question. Their intimacy changed in a single week, simply because he listened. The fourth pillar is nutrition. Blood flow and hormones are deeply influenced by diet. Foods like pomegranate dark chocolate and fatty fish naturally improve circulation. Magnesium and zinc support hormone balance. I tell patients, think of your dinner table as the foundation of your bedroom. What you eat every day sets the stage for how your body performs at night. The fifth pillar is environment. Intimacy after 60 often thrives, not in dramatic passion, but in calm, private space. Adjusting the bedroom with softer lighting, removing distractions, and creating a sense of ritual helps the mind let go of stress. A couple I guided recently placed a small lamp by their bed, turned off all electronics, and treated their evening massage as a ceremony. Within a month, they reported feeling closer than they had in years. When these pillars come together, movement, habitual touch, conversation, nutrition, and environment, the effect is exponential. It is not just better sex. It is deeper companionship, stronger health, and renewed excitement. I think of Margaret and Henry, both in their 70s. They told me they felt like newlyweds again after adopting this system. They no longer feared the bedroom as a place of frustration. Instead, it became a sanctuary of connection. Now, I turn to you. Which of these pillars do you feel is missing most in your life right now? Comment number 6. If you know the one you need to start with, or press, like if you feel ready to try them all. Remember, long-term change is not about perfection in one night. It is about creating a journey you and your partner can walk together step by step with patience and joy. As we come to the end of this lesson, I want you to remember one essential truth: intimacy after 60 is not over. It is simply different. It is more gentle, more thoughtful, and often more rewarding than the rushed experiences of youth. When you learn to use touch with intention, when you adopt small rituals like massage, And when you focus on connection instead of performance, you unlock a new chapter in your relationship. Think of the journey we have taken together. We began by breaking the myth that passion disappears with age. We explored the mistakes many couples make and the science that proves why massage and mindful touch can transform closeness. We looked at short-term actions you can try tonight and long-term habits that keep love alive year after year. Each of these steps points to the same message. Intimacy is a skill that grows stronger with care and practice. Now I want to challenge you. This week, dedicate at least 10 minutes each night to touch without expectation. Make it a massage, a gentle caress, or even holding hands in silence. Notice how your partner responds, and notice how you feel as well. After a few days, come back and share your experience. Comment number 7, if you are willing to try or press, like if you are not ready yet but want to learn more. Do not forget to subscribe so you never miss the next lesson. Together, we are building a community of men and women who believe that love and desire can thrive at any age. And as always, remember, this video is for informational purposes only and is not a substitute for professional medical advice. Please consult your physician for personalized guidance.